Morning, everyone. As Brian said, I work in the hospital, seeing patients every day who present with autoimmune conditions like rheumatoid arthritis and vasculitis and chronic pain and arthritis and allergies and things like that. And I use a whole person approach that for the last 8 years I've been doing that with patients, and I don't think there's many patients that have escaped this approach, partly because it's best to start out at the outset, with your cards on the table. And it's surprising actually that something like a food allergy can have ingredients or cofactors that can contribute, so that it doesn't look like, from a biomedical perspective, it doesn't look mind-body, if you like, or meaningful, but it really, really is. So I tend to unpack those sorts of things for patients, no matter what clinic I'm in. And so I have another clinic I work with the ophthalmologists as well, who treat people who've gone acutely blind, So I've deployed the whole person approach in lots of different circumstances, and I've experienced the benefits of it and also the resistance to it. So there's a resistance in the patient, because this is unconscious stuff that's in the body, if you like. And there's also resistance, I think, within the practitioner, who might not want to experience the distress or the feelings that might be unconscious. And there's also resistance, I think, in terms of dealing with your peers, because you might not be speaking the same language. How on earth do you explain your experiences with your patient? And I often take a sort of shortcut where I write to the GP and I say I've taken a whole person approach with this patient, and I don't really put any details in any further, because this is very intimate information about the patient's life. And that's the sort of route that I've taken in practicing in this way. Yeah. So I suppose my theme is, how do we create a healthcare that's where this happens for everyone, because this doesn't happen for a lot of patients. So they may go to the cardiology department with chest pain and get hypertension and have, a series of medical problems. And actually that story that's there never gets listened to. So that's actually happening to a lot of people. I'd say that's what's happening out there. And so you tend to be the only one sometimes that's doing any listening. Yeah. But I do think that there's a yearning out there for people who've gone into medicine. And it's not just doctors either, it's nurses, it's allied health professionals. There's a deep yearning to work in a different way. Just last week in the eye clinic, I met 4 people who I was just incidentally talking to in the corridor, who were just so excited to hear about what I'm doing. And I feel that there's a quickening at the moment in the zeitgeist, that the yearning is turning into something really more real, and that this is a sort of part of that. So it's quite exciting. So I actually have done some research into this. I've looked at chronic urticaria, which is a condition that we've chosen because it's reasonably benign, but someone gets itching or hives every day for about 6 weeks. And I've done a qualitative study, because actually a lot of biomedical research looks at objective findings. And these phenomena that's going on is largely subjective. So it's not just subjective, but there are real diseases, but the subjective phenomena is what's actually marginalised and pushed out of view. So in the research that we've done in chronic urticaria, we had some patients who'd been on medications for a long time, sometimes years, and they went through a whole person approach where they did have psychotherapy type intervention, where they saw Brian actually for an hour each week. And they got better. They came off their medications, And that study was actually small because it was a qualitative study. But what I analysed in terms of those patients was that they'd had something extraordinary happen to them that had overwhelmed their capacity emotionally and relationally to deal with it. And that somehow throughout that accompanied process that they'd experienced, that they'd changed their way of being in relation to themselves and others. And that might actually speak to the resistance that we're dealing with in some of these, cases where people are presenting with really physical illness. And you don't always get the story along with it. But I think research is going to be an important part of the future as well, but it's not necessarily going to be the type of research that we're used to. Everybody is in a different place with this. So I have colleagues that I speak to who work in a very biomedical way, and I have to deal with them one-on-one in a dialogue about my approach. And so it's strange to talk to a whole room because I don't really know where everyone is. I'm assuming you're all tending towards favourable, but you never know. But I often find as well that my life experience and my colleagues' life experience of actual illness is a bit of a storehouse that I can plunder sometimes in terms of helping me explain myself in terms of what I'm trying to do, because we've all had experiences of ill health and we all know our own stories, so we can all personally reflect on that. I think this idea about whole person healthcare, this idea that stories are in the body, this idea that disease, and I don't just mean psychosomatic or medically unexplained disease, is meaningful, is a really big idea. And I think that it's an idea and it can travel. And that can sort of transform healthcare. And that's why, having the website there where people can have a look just on their own, I think is really exciting. I think it's something that could travel really quickly. And one of the difficulties I have with the resistance of speaking to people is that it's not a societal idea. People have all sorts of different strange ideas about sort of maybe food or dietary exclusion. I had a patient yesterday who asked me about adrenal exhaustion, and things like that. So there's lots of ideas out there that are sort of barking up the right tree. But I think that this idea of treating the whole person, and that disease is meaningful is really powerful, but it's sometimes quite hard to explain. And people often need to be held relationally while that process is happening. So although I do send people off to look at the website, I sort of know that the circumstances around that person might mean that it's not really enough for them to sit and look at it on their own. They really need somebody to be there with them. So that's how I work in a whole person way in the hospital. It's really rewarding because sometimes you can just meet someone and spend an hour and they go away completely transformed. But then there's a lot of very serious disease that you have to use a lot of very toxic medications for, like life-threatening vasculitis and so on, where it's not appropriate to sort of do that sort of approach. So it's about when the time is right. Yeah. And I think I've said everything I've got to say there.